Good morning, all. Thank you today for participating in this webinar from the League of California Cities. It's a very unprecedented time, and you all have needs and related to COVID-19 and revenue loss, and we are pleased that we are able to go and secure some dollars through the CARES, our state budget to get CARES Act dollars from the state. We are pleased to be hosting this webinar today with the Department of Finance to discuss eligible expenses, reporting requirements, and additional information that will be associated with these dollars. We are pleased to announce that all cities did get applications into the Department of Finance to get your allocation that is set. So with that, I'd like to discuss a little bit what we'll be going through today. So the CARES Act does provide parameters through the federal government. We've had many inquiries from cities asking about potential eligible uses, some of them quite creative actually. It's important to ensure that we expend all these dollars, so we do appreciate that the Department of Finance has made themselves available today in working with us to make sure that we are getting information submitted to all of you to ensure that we do not leave one single penny on the table and that we can find appropriate uses for each of your cities. Want to really appreciate, send a thanks to the Department of Finance. They have been proactively engaging the League through this process to ensure that we've gotten information out to all cities about the application process, the different guidelines, and then participating on this webinar. And we do anticipate further follow-up from working with them in the upcoming months as we work to go and get all those dollars expended. So today's webinar will be discussing the CARES Act program for the cities, the eligible uses, compliance with state public health laws and orders, reporting requirements, and records retention. There will be opportunity for questions throughout. And for those who did submit questions in advance, those were submitted to the Department of Finance. And we do anticipate that those will be covered throughout the webinar. Next slide, please. With that, I'd like to introduce John Dunbar, our president and mayor of the town of Yountville, to provide some opening remarks.
Melanie, thank you very much, and good morning, and thanks to all of you that are with us today to talk about CARES Act funding for our cities. Since the beginning of the COVID-19 pandemic, cities have incurred millions of dollars in emergency spending to protect our residents and to reduce the spread of the coronavirus. During negotiations at the Capitol, the legislature and the governor reached a budget agreement that includes CARES Act funding for all cities, who did not, especially those that did not receive the direct allocation from the federal government, since only 6 of our 482 cities did in fact receive that initial funding based on population of over 500,000. Governor Newsom proposed $450 million in his May revise without a minimum allocation for each city, however. Thanks to the efforts by the League and many of you, our city leaders, we successfully made the case with the governor's office and legislators that cities needed more. And the final package includes $500 million for cities, including a minimum allocation of $50,000 per city. I wish it was $500,000 per city. While these funds will not cover all the expenses cities have incurred, they will provide meaningful support to help offset public health response costs. I'd like to thank you for completing the self-certification process. Melanie was just referencing that all of our cities did so on very short notice. In just about 10 days, all 482 California cities did submit certification to receive funds. This demonstrates our city's overwhelming need also for state assistance in our efforts to protect our communities from COVID-19. The League continues to work closely with the Department of Finance to ensure that this process is efficient and transparent. And we appreciate Kristen Shelton, Chief of the Research and Analysis Unit, for joining us today to answer questions about eligible uses, reporting, and deadlines. While the Department of Finance at this time plans to distribute these funds in 6 installments, we're continuing to urge the department to distribute these funds more quickly so that our cities can get financial relief immediately. We'll be talking about that. We also will continue to advocate at the state and federal levels for resources to address the $7 billion general revenue shortfalls cities are facing throughout the state of California due to the pandemic. Cities have supported and protected our residents and our businesses throughout the pandemic, and now we need support from our state and federal partners. Hopefully they will step up to support all of our cities, the economic engines of our state, after all, so we can continue to be a strong partner in the economic and the public health recovery in all of our communities. So I want to just thank you once again for taking the time to be with us today to learn a little bit more about the CARES Act funding opportunities. Again, thank you to Kristen Shelton for lending your expertise on this topic, and I'll now hand it back to Melanie. So thank you for being here.
Thank you, President, for those opening remarks. So we'll first go off into a little bit of the housekeeping part of the webinar, and then we'll get into what you really want to know about is how you can expend these dollars. So for housekeeping, please make sure your audio is connected. You should have been prompted to connect your audio when joining the webinar, but you can confirm by clicking the audio settings on your toolbar. As you may have noticed, we have muted all phone lines for the participants. We will have an opportunity for live questions throughout the presentation. This webinar is being recorded, and a link to the recording will be publicly distributed following today's event. Additionally, we will have the slides available on our website, which I will provide the link at the end so that you can download those. For asking a question, to write in a question, select the Q&A button on your toolbar. You can also upvote other attendees' questions if you have the same question. This will help speakers prioritize questions during the Q&A portion of the presentation. With that, I would like to introduce Kristen Shelton, who has a tremendous resume with the Department of Finance with over 20 years experience working for that organization and has worked in several different aspects of the Department of Finance, and so has a very broad knowledge of the state's inner workings, how the budget works, and working with local governments. With this, I'd like to introduce Kristen Shelton, the Chief of the Research and Analysis Unit of the California Department of Finance. Kristen, the screen is yours.
Excellent, thank you. Good morning. I'm really excited to see that there's so many participants. It's always easy to get a large audience when you're talking about money. Go ahead and go to my first slide, please. So I think Melanie really covered the objectives today, so I'm going to move on into the slides because I want to leave plenty of time at the end relative to questions and answers. So the CARES Act has some really broad requirements related to the use of the funds, and the legislation in and of itself really was fairly vague and high level. And then this guidance and the statutory framework has been updated frequently, which my team is responsible for tracking all of the changes that have come up with the most recent update on July 8th. So you can imagine that we are sometimes looking, you know, excuse me, looking to, excuse me, hold on. To the federal government through a variety of sources to really get the most up-to-date and current information. I have a small team in the Department of Finance that has been tracking all the funds, including the CRF coming to the state, and the state is currently tracking and expects to receive over $70 billion in relief from the federal government. That's directly through the state budget. The vast majority of that is related to our unemployment insurance program, as there's significant federal relief, particularly through the end of July, that's been provided in response to COVID-19. We are also tracking direct relief totaling about $140 billion going to individuals, businesses, and hospitals in particular. So relative to the CARES Act and the coronavirus relief funds, all of the costs have to be what's called necessary expenditures to address COVID-19 public health emergency. You're going to hear me talking about what's necessary often. It is repeated quite often in the federal guidance. And it is intended to be related to both the direct response to COVID-19, as well as what the federal government terms second order effects, such as economic support to businesses, individuals, and otherwise related to COVID-19. The funds cannot be accounted for in the most recently approved budget. What that really means is the budgets that were enacted prior to the federal appropriations provided for in the CARES Act and a couple other bills. It does not include, and I think this is important, any of the supplemental appropriations or budget adjustments that were done in response to COVID-19. So at the state level, we enacted 2 emergency bills on March 17th that provided supplemental funding to the state to give us some ready access to emergency resources to be able to address the response. Those dollars would be eligible and allowable for reimbursement through COVID. So from a local perspective, if you took similar actions to give yourself more authority for spending and dealing with the response, all of those costs would be eligible. All of the expenses have to be incurred between March 1st, 2020 and December 30th, 2020. And so we will spend some time talking about what that means. Next slide, please. As with any guidance where there's flexibility, there are also limitations. The federal guidance definitely noted that the CARES Act limitations related to the coronavirus relief funds could not be used to backfill lost revenue. This is a big disappointment for states and localities, I'm sure, and certainly as we continue to work with our congressional delegation to secure more resources for states and local governments, we would not only be looking for more money, but also more flexibility, as a huge part of the response effort and the impacts are really about that revenue that's been lost at both the state and local level. Funds cannot be used as a match for the non-federal share of state Medicaid program, Medi-Cal in California. It cannot be used to fund any employees or benefit costs if they're not substantially dedicated to response of COVID-19, and we'll definitely talk about that a bit more in later slides. Can't be used for workforce bonuses or damages covered by insurance. It cannot be used to help people be able to pay property taxes. So if owners are not able to make their property taxes, any assistance provided at the state or local level for that is really viewed by the federal government as a revenue replacement. So that assistance is not allowed. It also does not allow any things that are identified already specifically in the Treasury FAQs. So we have to comply with the FAQs, which continue to be updated regularly. As I noted, July 8th was the last time we got an update. Next slide. So because of some of the limitations and because the CARES Act basically indicates that the initial recipient or the direct recipient of the coronavirus relief funds is responsible for any disallowances or ineligible costs that are found later on in the process, the state is the one that would have that recoupment responsibility. We are required to gather and report information to the federal government on the use of the funds. And I will talk a little bit about recent reporting requirements that were just distributed on July 2nd later on. We also would be required to do what's considered subrecipient monitoring, and that could include audit and oversight. Because of these responsibilities, the state has included several processes to safeguard against the use of the funds and kind of share that risk, if you will, with local governments. So we included a certification process that was really modeled after the federal process. We've established kind of a reporting or checkpoint related to the funding, and we have a control section that allows us to be able to implement and allocate those funds and to ensure that we're complying with the federal requirements. One thing that's of note, not just with the federal coronavirus relief funds, but also with all of the federal funding, predominantly through the CARES Act, there is substantial funding allocated to the federal government for oversight of the receipt, disbursement, and use of the funds. And for coronavirus relief funds in particular, $35 million was provided to the federal US Treasury Office of the Inspector General for oversight of these funds. Next slide, please. So I know we have received numerous questions about the expenditure categories, and these are detailed at the federal website, which is identified at the end of my slide presentation. But I wanted to go through some of those high-level expenses and categories with you today, and I think it will help give you a sense of the options and the areas in which you can put these funds to work for your communities. So the first is those direct medical expenses. That can include expenses related to public hospitals or community clinics. It can be temporary medical facilities that are established to deal with a surge in cases. It includes testing, both what we call serological and antibody testing, as well as just testing for the virus itself. It can include as well emergency medical response. That includes emergency medical transportation. So think of your local emergency EMTs, think of your local fire departments and transportation that might be related to that. Those costs are eligible relative to the medical response associated with COVID-19. You would also be able to claim costs related to establishing and operating public telemedicine capabilities. Certainly the state had been doing a little bit in this area, but we have had to, out of necessity, kind of expand those capabilities. So the equipment, the resources necessary to both establish and operate those capabilities are allowable expenditures under the coronavirus relief funds. Next slide, please. So public health expenses, these include both your communication and enforcement, so updates to your local websites, being able to get materials and information out to your businesses about what the state requirements are, when they can be open, when they need to pull back, etc. It includes acquisition and distribution of medical and protective supplies. That includes your personal protective equipment, or PPE, as well as cleaning supplies related to public safety and public health. That includes your ability and your requirements to disinfect public areas. So think about your local parks and other city facilities that might need to be disinfected regularly or more frequently than normal so that the public can safely access those facilities and resources. It also can cover technical assistance on mitigation. So any costs related to providing that guidance, technical assistance to businesses can also be used as under this category of expenditure. Public safety measures in response to COVID-19 and the ability to quarantine individuals, which is a huge part of being able to slow the spread relative to social distancing. Those are also allowable. Next slide, please. This next category really deals with what is termed as substantially dedicated payroll expenses. This can include your public health, public safety, healthcare, human services, and similar employees. One thing that the federal government did, which is intended to be and has been broadly characterized to be a flexibility to local governments, is the idea that both your public health and your public safety staff are presumed to be substantially dedicated. That is intended to provide ready funding to address unforeseen financial needs and financial risks created by COVID. And it was really done, as the federal government demonstrates in their guidance, as an administrative convenience, that there is this underlying assumption that these staff are deemed financially, substantially dedicated. When I think about this deeming, I kind of liken it to what I would consider presumptive eligibility in certain public programs. And what that means is that without having to go to great lengths to document and demonstrate that these staff were substantially dedicated to mitigating or responded to COVID-19, you can just automatically assume that. And this is repeated throughout the federal guidance in a variety of ways. And so one piece of the guidance that I would kind of highlight here in my talking points is that that the way that they've said that is that these staff, the entire payroll cost of these employees whose time is dedicated to mitigating or responding is eligible. So the entirety, not a percentage, not overtime hours or certain kinds of hours in terms of working, but the entire payroll cost. And this would include those base payroll costs that would have been in your locally approved budgets at the time. I'm going to spend a little bit more time on the next slide, please, related to that idea of substantially dedicated. So kind of highlighted a little bit that you don't have to have for these substantially dedicated public health and public safety workers as much documentation about the work and the activities that they're performing. So while the CARES Act does not allow for backfill of lost revenue, this administrative convenience has been kind of provided as a tool to assume that those costs can be paid by the coronavirus relief funds. And that has the potential to free up what we would consider general purpose or general fund at the state level monies. And it can partially help offset some of the lower receipts or the lower revenues. And as I stated before, the full payroll and benefit costs associated with public health and public safety can be paid by or reimbursed by the coronavirus relief funds. Next slide. Sorry, they also included in what we would consider substantially dedicated is the idea that staff that were repurposed to what's considered a previously unbudgeted function, or rather than being either laid off or furloughed or on administrative time off, those staff can be fully reimbursed by the coronavirus relief fund to the extent that they were repurposed to address COVID response. It can also include overtime of additional hours that are outside the normal and historical duties. So I think about the Department of Finance and the kind of overtime that we sometimes will do throughout the year relative to budget preparation. We kind of have a general baseline or historic average of the amount of overtime that we work. We could, if we so chose, to talk about or claim and reimburse coronavirus relief funds for overtime that was kind of arduous and above and beyond the typical overtime that we might have. That would require setting kind of this baseline or being able to document our baseline of average overtime over some period of time and comparing it to the level of overtime that might have been needed relative to COVID response, which has certainly been unprecedented. As I noted before, there's no percent threshold. There is some discretion with appropriate documentation at the local level, such as using your timekeeping systems or having some kind of rationale that was used to demonstrate the change in duties and functions. You can also use coronavirus relief funds to reimburse for other funds that may have been incurred the initial expense. So as I noted at the state level, we took many actions early on to be able to address the crisis, but we have intention to go back and reimburse some of those general purpose monies with coronavirus relief funds later. Next slide. So on this next slide, I wanted to just give you kind of a sense of some of the examples at the state level, just to really kind of prime the pump, if you will, or think about ways that we are thinking about using coronavirus relief funds. So first, the group that I'm associated with does specialized kind of in-depth reviews of departments, programs, and activities. We essentially paused all of that work, which had a little bit more flexible timing, and shifted my team to track all of the federal funds related to COVID-19, including coronavirus relief funds. So all of our staff and expenses are being separately tracked and reported within our timekeeping and reporting process, with the broad thinking that we could use coronavirus relief funds because we've really been redirected or redeployed to a totally different activity. There's also the idea that some of our staff and our jobs are not suitable for telework. When I think about things at the local level, I think about, some of your library closures, parks and rec type programs that might be provided. All of those things were no longer happening, and those employees associated with that work or those programs were really not suitable for telework. However, They could have been redeployed to help with things, which what we did at the state level is we redeployed our staff to both supporting the significant increase in unemployment insurance, and then also to help us set up for medical surge. This can also be for areas where the work was maybe delayed. So thinking of our franchise tax board and the delay in the tax filing deadline, when that was delayed, we had a number of staff that were, ready and trained on board dealing with tax returns that were being submitted to the franchise tax board, and they really weren't able to do that work because that work slowed to a trickle when the deadline was extended. Those staff were put on administrative time off, and ultimately we used them to help with that unemployment insurance, and then also to help with tax filing. So you may, the medical surge. So they helped us actually set up facilities to deal with potential surge that was expected early on. We also have trained state agency staff to be redirected to help support efforts at the local level for contact tracing. And so we have trained a number of staff and are deploying them to help county public health offices upon request do the contact tracing once you have positive test results for a particular individual. So all of those costs can be separately paid either with the coronavirus relief funds or another federal source. And then we did a lot of work at the state level on our IT infrastructure, both to support the tracking and reporting that's happening, to set up those databases and those pages. My team has been working with IT staff in our office to both set up the websites that you access to do the certification, as well as to help us with State Department reporting, similar to what we did in ARA on all of the federal stimulus funds. And so all of those costs are eligible for CRF. It also includes new online services. So think about our Department of Motor Vehicles. While we had been moving in that direction as we were trying to address Real ID implementation, the COVID emergency really pushed us much further into that direction. So we could claim or use the coronavirus relief funds to address some of those expenses that we had at the state level. Next slide, please. Excuse me. So the other category of expenditure really is about how states and localities help support vulnerable populations or communities in complying with the public health measures and to minimize the effect of COVID-19. So that includes food delivery, so think Meals on Wheels to seniors and other vulnerable populations. Telework capabilities for public employees. So that could include providing the equipment necessary, or maybe expanding the software that's necessary because you had many more employees doing telework than you would have done in kind of a normal operating mode. I will note that as I said throughout the federal guidance where they talk about telework, they talk about that it has to be necessary to the public health emergency. And that could include the idea of stipends, but you have to make that determination that both it's necessary and that it's of administrative necessity to be able to provide those reimbursements to individuals that are now teleworking in kind of a different manner than might have been done incidentally in the past. And then there is guidance, specific federal guidance that be more on a reimbursement basis, predominantly to ensure as much as possible that the funds are really used to cover what would be considered eligible expenses. Providing paid sick, paid family, and medical leave to public employees. So as you may know, the federal law did implement some expansions to kind of underlying paid sick and paid family leave related to COVID-19, but local governments aren't typically like traditional employers in terms of contributing into those kind of underlying programs, which means that we were paying those expenses through our base budgets or base appropriations. you can use the coronavirus relief funds as a means for backfilling or repaying those funds related to that paid sick leave. And that included individuals that were unable to work because they didn't have child care, not because they were necessarily infected with COVID-19. It can also include maintaining jails, so local jails, including sanitation or improvement in social distancing measures. At the state level, we kind of repurposed some of our facilities to be able to make sure that we could do social distancing. And so we use spaces a little differently. So any of those costs associated with staffing, additional spaces, or for additional sanitation measures in between, or even shifting from a kind of cafeteria style meal delivery to a more brown bag or individually packaged style of meals, those kinds of costs could be allowed. And then caring for your homeless population. So this is partly addressed at the state level related to our Project Room Key, but you could have services and other activities related to caring for your homeless populations and to kind of mitigate and comply with the public health measures. So that could be the housing that's supporting those individuals and families at risk of homelessness. It could also be in broader shelters doing different kinds of precautions or cleaning protocols to address or mitigate the spread of COVID. One other item in this category I just mentioned briefly is the support of distance learning. That really is more for schools, but that is an eligible component of this category at the federal level. Next slide, please. As I mentioned previously, economic support is one area in which localities can support their communities, and it is certainly an allowable expense. I saw a number of questions relative to being able to provide assistance to businesses and individuals. So this slide kind of touches on that. So grants to small businesses for the cost of business interruption can be made. Grants or financial assistance can be provided, perhaps to support with overdue rent or mortgage, to avoid eviction, and or to provide assistance to deal with unanticipated funeral expenses. Generally, this kind of financial assistance should be structured in a way as much as possible and administratively feasible to make that assessment that the assistance is necessary, and that and so there should be some sort of kind of application process or review process to make sure that the people really need those funds. A slightly different take on some level than the economic impact payments were given broad-based at the federal level to anybody without kind of real regard for need, although they did have some income thresholds. So there is an expectation that there is an economic hardship and some kind of verification. This could also be not just direct assistance to an individual, but you could assist a particular community-based organization that could then do that screening on your behalf to be able to provide such grants. So it could be to landlords with the assistance passed on to the tenants of a particular housing unit. It could also include a payroll support program. So we know that at the federal level and even at the state level, we have tried to address some payroll support needs. So there's significant funds coming into California, but it really didn't benefit all of our businesses. And there were challenges, certainly, when you think of your small businesses accessing those funds. The state program does try to address some of those gaps in the federal program and eligibility, but localities could choose to do something in addition to what's happening at both the federal and state level relative to payroll support programs and keeping people getting a normal paycheck, but not necessarily having to report to work. And then I know that I saw this question come up. So unemployment insurance costs can be reimbursed if they're not already federally reimbursed. So many local governments use a reimbursement method rather than what we view as the experience rating method to finance their unemployment insurance programs. And so if you are on a reimbursement basis and you're now getting billed for unemployment insurance costs, or will be billed or anticipate being billed for layoffs at the local level, you can use coronavirus relief funds to actually repay those costs that would be advanced through the unemployment insurance program. And because you obviously can't access some of the funding that was allowed at the federal level to be able to offset employment and payroll taxes. And I do want to just pause here for a moment too. There was one particular question that I recall related to the timing of that, and this kind of will get touched on a little bit relative to our reporting process that's going to be later on, but for the state and federal reporting requirements. A reasonable estimate would certainly be allowable, and we'll talk a little bit more about what you anticipate to kind of avoid those timing situations relative to when that EDD bill might come out. Next slide. So as with almost every pot of funding, there's frequently an other category. So there is an other category relative to the coronavirus relief funds, so long as those expenses are reasonably necessary to function as a government, and it satisfies those broad eligibility criteria. A few things that I would just note that's kind of layered in some of the frequently asked questions at the federal guidance level is hazard pay. So hazard pay and overtime for those substantially dedicated staff is certainly allowable. So there are some both local staff that might get a pay differential early on to help support the COVID response, or situations like I heard where Amazon was providing a $2 an hour bump for those individuals that were viewed as essential staff to respond to and help the country as a whole mitigate COVID. So that $2 differential in pay, if done similarly at the local level, would be a reimbursable or allowable expense. Yeah, it could include workers' compensation costs. So if employees were affected by COVID and submitted a workers' comp claim, those costs could be reimbursed by COVID. The only thing there is that it has to still be during that covered period. So between March 1st and December 30th of 2020. Leases renewed solely to respond to COVID. So at different points in time, the state or localities may have spaces that they're no longer going to lease, but they may have been repurposed or renewed solely to respond to COVID, maybe to address medical surge or testing in your community. And so those types of leases could be then used as or repaid under the coronavirus relief funds. Public health emergency recovery planning is also an eligible and allowable use of CRF. If there was some decision at the local level to do some additional support to private hospitals, such as a grant or what I would view as a short-term loan, could be eligible. I'm going to take a moment to talk about loans in particular. Grants are certainly viewed as more desirable and easier to manage. Loans really have to stay in that covered period. So repayment, if it goes beyond that December 30th, 2020 timeline, would actually, when those funds got repaid as a loan, they would have to be remitted straight to the federal government. If it was a shorter term loan, so really a stopgap measure, maybe until federal relief was available through another means, and it was repaid before that December 30th period, it could be reinvested or used for another allowable purchase. So we will talk about that a little bit more too in a future slide. And then to support enrollment in government benefit programs. So being able to increase funding and help people access some of our safety net programs. Those staff and additional staffing resources that might be needed could also be eligible in terms of a CRF. There's a couple of things that are also in the guidance that I didn't fit on my slide, but I'll just really quickly talk about. So livestock depopulation, particularly as a result of supply chain disruptions, is an allowable expense. Employment and training programs that are necessary due to the public health emergency are allowable. And then, as I mentioned before, grants to avoid eviction or homelessness and other kinds of financial relief are also allowed here. With that, we're going to just pause for a moment and so that you don't have to keep listening to me talk. We're going to do a quick poll for local entities just to give us a flavor of how you think you might be using the vast majority of your federal CRF funds that are going to be allocated to you as an entity. The poll looks like it's been launched. Go ahead and answer again for where you think you're most likely to use these funds locally.
Kristen, we have over 500 people that have voted so far. We'll give it another about 15 seconds or so and we can close it out.
Yep, that sounds great.
Perfect. And then we'll launch into some questions that are pertaining to these specific categories, and then we'll go into the next section of your slide.
Excellent.
Okay, we will end the polling with that.
Thank you. Just a couple comments relative to the polling. I'm really glad to see that the vast majority is really going to be related to both public health and public safety elements of the coronavirus relief funds and those categories. That is certainly the place where cities are going to be able to maximize the relief related to coronavirus relief funds and, you know, have less documentation and reporting kind of associated with it. So I'm glad to see that is an area that is really, you know, high level in terms of planned spending. Thank you so much.
Great, and with that, let's go and get into some of the questions. So first off, you talked about IT staff, but can a city use the funds for IT items that enhance remote reporting or remote working capabilities, server upgrades, system storage, and laptops? Also, we've moved to a lot of city council meetings being moved to online. You know, what are the eligible uses within that as well for switching to those capacities?
So all of those equipment items, as long as you can indicate that they are necessary. So if you have to buy laptops so that staff can telework or upgrade servers and systems because you've got many more people using kind of remote desktop programs and software, all of those are very clearly eligible uses of the funds. One thing that they talk about in the federal guidance is that just merely changing your location to be able to do your job is not necessarily an allowable use, but all of the preparatory work that might kind of go above and beyond to move to some of those types of platforms is certainly eligible. So think of distance learning. Just education and delivering online is not necessarily eligible, but the staff time to kind of change the way your materials are both received and presented, and kind of figuring out how you adapt are all certainly eligible. Software tools that are purchased, so such as Zoom, to be able to support that, and those licenses are all very clearly eligible uses of CRF.
Great, thank you. The next question, as we talk about that substantially dedicated to employees regarding the payments for public health, public safety employees, and substantially dedicated to mitigating or responding to the COVID-19 public health emergency. I think you touched on this a little bit, but the guidance does not recommend an allocation methodology or percent allocation. Is there a recommendation for that, or is it really being left to the jurisdiction of the cities to make that determination of that substantially dedicated category?
So for public health and public safety, you actually don't have to make that determination. So you can presume that 100% of your public health and public safety staff are already substantially dedicated. So you could completely shift 100% of those staff costs. The way that I would probably recommend or advise you would demonstrate that is if your budget is on some sort of line item basis that was adopted at the beginning of the year, and it shows what your public health department or what you term public safety, you could completely replace those general purpose funds with coronavirus relief funds. Where you have to make that case or demonstrate or document substantially dedicated, it is more on your other types of employees. So I'll mention maybe Parks and Rec employees had to become substantially dedicated because they had to go and they kind of changed their routine. They had to close up facilities. They spent a portion of their time doing that. They are doing different cleaning protocols. Those types of things could be viewed as substantially dedicated. There's no real percent threshold. It's about having local ability to track and make that case for to the federal government should there be an audit. So any kind of timekeeping system or way that you can demonstrate hours. So for instance, most of my staff were 100% dedicated, but some of my staff split their duties. We created a new code in our timekeeping system so that we could identify when they were working on solely COVID-19 response and tracking functions. And then we could use that as justification or backup for those that aren't public health, public safety staff. I will say that in conversations both at the federal level with other state associations, governors associations, accounting and controllers, many states are being very liberal in their interpretation, particularly with the public health and public safety. Some are even going so far as assuming their state correctional staff are defined in federal laws, public safety, and shifting some of those costs. We're being a little more conservative here in California, and we'll kind of look more at those direct activities related to response and mitigation.
Great. And just really quick for everyone to know, we do have a substantial amount of Q&A that I know Kristen is able to stay much longer than the 12:30 end time that we have initially put in place. But Kristen, just in advance, would you be willing to ensure that we can work with you on getting fact sheets and website information? So I don't know if we'll be able to touch all the questions that everyone has asked because there's so many nuances, but want to make sure that, as you said, we want to make sure the cities are spending every single cent that they are getting. So we need that in advance. I'll ask a few more questions, then we'll go on to the next portion of your presentation regarding the reporting, audits, and compliance components. So if for the funds that are used for loan and grants to small businesses affected by COVID-19, is the agency required to have those loan grant applicants provide documentation, certification that they are affected by COVID-19?
Generally, there should be some process. We would probably recommend that a similar model to what we used in terms of a high-level certification or some demonstration that their business was closed or they were affected. They don't necessarily have to give you financial records and that level of detail, but certainly there should be some ministerial process related to that oversight of any of those kinds of grant funds.
Great. For cities that are assisting restaurants by supplying equipment and barriers to allow for outside dining, are there any restrictions on the use of funds for these purposes?
No, nothing that I'm aware of.
Will the funds cover unanticipated expenses to provide paid sick leave and paid family medical leave to enable compliance with public health precautions related to COVID?
So for your local employees, yes, as I talked about relative to both paid sick and paid family, it is an allowable use of coronavirus relief funds.
Great. Bear with me for a moment as we're working through these. We appreciate all the engagement by the cities and definitely will be in further conversations providing you more information after this webinar. So does substantially dedicated apply to emergency operations center staff regular time in response to COVID impacts?
So you're talking about like your like dispatch, maybe your fire, et cetera.
Yes.
I think that there's kind of a line here. So I think that to the extent that their base funding is doing normal kind of screening of calls, et cetera, that's likely not allowable under CRF unless they're very clearly defined as public health or public safety. But any specifics, you know, for each and every call that they went out on where they were transporting or responding to somebody that had COVID-19 symptoms and you have ability to track, you can certainly use these funds to reimburse those costs.
Great. And can CARES Act funds be used for non-FEMA cost share cost?
We will be talking about that momentarily, so we'll defer that question.
To the punch on that, sorry. Just giving a preview to everyone here. Let me see if there's a couple more questions. Are legal fees not budgeted COVID-19 eligible expenses?
You know, that is not one that I've heard yet, and there's certainly no guidance in that. We know that if you had audit costs, that cost to support kind of the audit and the tracking would be eligible. I would think that on some level that is perhaps eligible, but I think you have many more expenses that would be a better candidate for CRF. So I would probably hesitate to recommend that as kind of a first order area to use the CRF.
Okay. You did talk about the quarantining of individuals during part of the presentation. So I just really want to clarify. So can city employees who are quarantined due to exposure of COVID-19, are those eligible costs?
If the city is actually, let's say, accessing or using a hotel or motel that's not already funded by the state, because remember the state has used Project Room Key both for homeless and for you know, personnel, particularly in the medical area, for quarantine if they didn't have a suitable ability to quarantine at home. So if you are paying for that out of pocket, it certainly is a reasonable expense and it's an eligible expense under the criteria.
Great. We have so many more questions. Let's get to the next part of your presentation and we'll work through to see how we can consolidate to try to get the vast 130 plus questions we have coming in so that we can get some of those more targeted to address more, a lot of the questions that are coming in right now.
Yeah, maybe you guys can kind of consolidate a little bit, and hopefully I'll touch on many of them in the presentation.
Great, thank you.
So our next slide just spends a moment talking again about the cost incurred in that time period, so March 1st to December 30th. Early guidance at the federal level. Oh, is the poll, do I have to close the poll? Yeah, okay, on my screen, sorry, distracted. Early guidance really said that funds had to be spent, so cash out the door, not just obligated or encumbered by December 30th. Fortunately, recent guidance kind of provides for a reasonable liquidation period. So as of the end of June, we got guidance from the federal government that there is a reasonable liquidation period. They kind of noted in that guidance that they view most of them would be within this 30 days. And coupled together with that reasonable liquidation period is really the idea that the performance or the activity or the delivery of a good must be expected or occurred during the cover period. So bulk purchases can be used though beyond December if a portion is used during the covered period. So I'll use PPE as an example because certainly states and localities are spending tremendous resources on that. So you wouldn't want to, and it probably would be frowned upon and likely result in audit exception to, as of December 28th, decide to go make a really big bulk purchase of PPE because you hadn't fully exhausted coronavirus relief funds. However, if you did purchase in July, August, September at a bulk purchase level based on what you thought your projected need was locally for PPE, and you got to the end of December and you still had some masks and other items available to continue to use, you could use them beyond that December time period. So it's really, again, about this idea of reasonableness and necessary to respond. The other thing that is certainly noted, and we're feeling this even now, we certainly felt it significantly early on in the process, that there may be supply chain disruptions that are beyond a recipient's control to address. So if you made that purchase, let's say in September or October of PPE, based on what you think it would take to get you through the next 3 months of the calendar year, and because of inadequate supply chain, those supplies didn't actually show up at the local level until much later, say in January, the locality can be able to pay for that during that liquidation period when they get received, and there wouldn't be any penalty related to that, particularly if it was beyond your control. And as I talked about, the idea of grants and loans have to be during this period. I won't belabor the point. The slides will be available and posted. But again, really trying to make sure that your expenses and your covered costs happen in that December 30th timeframe, and any loans, if you do short-term loans, they are truly short-term and allow yourself at the local level to be able to spend those funds when the loans are repaid. Otherwise, they just go back to the federal government, and we don't want that to happen. Next slide talks a little bit about unspent funds. So as I said, they have to be returned to the US Treasury at the end of the covered period. Subrecipients are also bound by this requirement. So that means all expenses have to be incurred during that covered period. Want to re-emphasize that an obligation or an award or a commitment to spend is not considered spent in the eyes of the US Treasury. So the direct recipient of the funds, which is the state in this case, is ultimately responsible for compliance with these limitations on the use of the funds. And because we at the state level want to make sure that all of the funds are spent, and that is our goal, both to maximize the spending, not return any funding to the federal government. And it's part of why we want to guide and help advise on ways in which locals can use the funds. And we have a check-in point relative to kind of getting a sense of where individuals are related to spending, which I'll talk about in a little more detail later at September 1st. But I do want to reassure folks that is merely viewed as a check-in point to give us time to react quickly to maximize the use and fully spend all of the federal funds. Next slide. So the question regarding whether the CRF can be used as a FEMA match has been a question that we've heard different answers to since the CARES Act was enacted. Early on, we were told and advised that CRF could not be used as a match for the non-federal Stafford Act share of public assistance. We later were told, I think following comments from the president, that it would be an allowable match, and we kind of waited for clarification in the guidance relative to that, and it took some time for that to come out, but we did get broad guidance related to the ability to use funds as a match. However, I'm going to throw a little bit of a wet blanket on this idea, partly because the guidance, the way in which it was structured, gave a fair bit of latitude to FEMA. So while it can be used as the non-federal match for public assistance, it has to kind of address both the CRF criteria as well as a FEMA decision point where they may decide not to pay for certain costs, particularly if there's other federal funding available. So as I mentioned, you know, California is expecting about over $200 billion in federal resources, some of which is flowing through the state, some of which is going directly, such as funding and assistance to community hospitals, for instance. And we have already heard from FEMA, based on their guidance, that there are certain costs that they have determined that are more appropriately paid by another federal agency and another federal fund source, so not reimbursable with a combination of CRF and federal public assistance funds. And so we're kind of approaching this idea with a little bit of caution, and we're trying to get more clarification. I had really hoped that we would have better guidance from FEMA before I did this presentation, both for counties and cities. So for contact tracing, they have been very, very clear. We still at the state level are making the case that the costs associated with contact tracing far exceed any of the available federal funding streams, and are continuing to assert and try to pursue federal FEMA funding for those costs that are above and beyond the available funding from the CDC. We would recommend that local entities coordinate very closely with Cal OES on what places they may be able to use CRF as a public assistance match. And then if we get more guidance, or as we kind of learn more, or try to narrow in a little bit about where this is possible, we will certainly share that both on our website and through our partnerships with both the League and the county associations. So we know that this could be a really powerful tool, and certainly could make these small dollar amounts go much further. But at this point in time, we're not feeling terribly reassured that we wouldn't end up in a situation where many months and probably years later, we would have used our CRF dollars to match FEMA funds, and then it turns out that that's not allowable use, and you know, end up in a situation where we end up having to repay or not get repaid at the local level on funding that we are kind of counting on. So next slide. So as I noted, we implemented through our Budget Act a control section that gave us needed flexibility to be able to appropriate and allocate the coronavirus relief funds. We were really pleased in working with the League that 100% of cities came in for the initial certification, and they agreed through that process on using the funds in a way that's consistent with the Federal CARES Act, that there would be adherence to state executive orders and Department of Public Health orders, directives, and guidance related to COVID-19. That there will be reporting on that September 1st timeline, as well as a summary provided related to not duplicating efforts. As I noted, there is a lot of funding that's kind of coming into the state, and there's some choices about what's the best funding source to be able to use to meet some of the costs and expenses associated with COVID. So we want to make sure that cities and counties are coordinating among themselves, making sure that they've got safeguards in place to not duplicate or get reimbursed for an expense more than once through one funding source, and that they're doing things from a regional and level that are thinking about the best ways that the state can respond, you know, and meet community needs at the local level. So that check-in happens on September 1st. We We'll model our report based on the federal reporting guidelines and instructions, which are still coming out. We have a slide to talk a little bit about some high-level reporting that's due at the end of this week. And we view this reporting as kind of a starting place for the conversation so that we can help maximize the funds and work with both cities and counties on making sure that funds are spent. To the extent that we're not successful in that area, there is a requirement in our certification to return those funds by October 30th, but we made it really clear in that process, unless that's extended, that time frame is extended by Department of Finance. So what I am thinking about in terms of that process, because obviously we're going to have more than 500 of these to review from a state and both a city and county level, that we will contact those entities that we think are at risk to talk about ways that the funds could be spent and fully used at the local level. But we won't be probably trying to tell everybody else like you're good to go just because there's such a volume there. So if you don't hear from us, you should consider yourself lucky, and we will continue to provide updates on our website relative to any areas where we think we might need to have unspent funds returned and reallocated. There is a new federal requirement to retain records. So we had records retention kind of broadly talked about, but it will be to help support those reported expenditures and then agreement to participate in any state and federal audits. Next slide, please. I'm going to just really quickly touch on the next few slides related to compliance with public health orders, because the primary responsibility, obviously, from a public health standpoint is at the county level, but there is some overlap and certainly coordination and partnership that's occurring with cities and their respective counties about, ensuring and verifying compliance. So finance will be coordinating with Department of Public Health as well as Cal OES to verify compliance before each of our allocation processes. And the state may withhold and or redirect funds if it's determined that there's not compliance. We really do view this as a collaborative effort, and we intend to fully collaborate if there are concerns that are raised or identified by Department of Public Health or Cal OES, and engage with local leadership to kind of move back toward compliance. And the most important thing I think for localities to really consider and make sure that it's not happening, but no city ordinances or resolutions that are inconsistent with the broader stay-at-home orders should be adopted. That will be an area where we would look for a rescission of any of those kinds of ordinances or resolutions that were made before we would allocate funding. Again, our intent is to get the money out, have it be used. We know it's necessary to be able to respond related to the process. And just for your awareness, there is no monthly attestation process for cities, but there is a process predominantly tied to the general fund monies that are going to backfill realignment revenues for certain county public health and behavioral health, et cetera, programs. Next slide, please. So these are the conditions that the local public health counties must meet related to that monthly determination. But we totally recognize, particularly in larger cities, that they are a big part of supporting the county and being able to meet these conditions. And so there's a lot of coordination and collaboration that will go on at the local level relative to testing, tracing, and supporting our homeless populations. Next slide, please. And then counties are also participating, but I'm sure that there is data coming from multiple areas, either at the city or within the hospital system, relative to reporting on the transmission of diseases, the disease, and then commitment to kind of institute what we consider non-pharmaceutical interventions, so closures of indoor places, and particular types of higher risk businesses as needed. Next slide. The part that you're all probably really interested in. So the initial allocation of the coronavirus relief funds will be made, so it'll be 1/6 of the $500 million that's available statewide. If you haven't already seen the amount by city, that is information posted on our website. So the Department of Finance website, this information is there. It's in the same place where you would have accessed the certification form that was submitted earlier this week. We are working kind of concurrently to prepare both the schedule for that 1/6 of the allocation, so 1/6 of the total by city, and doing what was required in terms of notification to the legislature this week. So we are doing those kind of in tandem. We have also taken steps to work with both our controller and treasurer so that they know, one, this payment is coming, two, to be able to help speed up that process. So our treasurer has to make sure that that cash is on hand and available for those payments to be able to go out. And our expectation is to have all of our notification happening this week, with allocations happening within 10 to 14 days. And both the notification to the legislature and the schedule to the controllers will happen concurrently. So our hope is that they will begin their work and their process as we are seeking kind of concurrence from the legislature to be able to allocate the funds. We also intend to notify the legislature of our broader allocation schedule, and would only go back to the legislature if we have to deviate from that schedule due to non-compliance. So very shortly after the first allocation goes out, for anybody that remains in compliance as of August 1st, we will prepare the second schedule for another 1/6 of the allocation. We'll repeat that process in September. At that point, we would get all of the reports from local entities. After we work through those reports and review, we would do the final allocation for the balance of the funds to cities in compliance that also submitted the required report. And we're hoping to get that out by the end of October. So all of the cash would be in hand at the local level about halfway through the current fiscal year, or the 6-month period of the fiscal year. Next slide, please. As I mentioned, we will have a reporting process. We're kind of having to adapt and pivot a little bit because we got new federal guidance this week. And so the initial report that we had kind of envisioned for September 1st was really a checkpoint to make sure everybody was on track relative to spending. We now have to report to the federal government on the 17th of July. As kind of a preliminary report. And then we will have to do a follow-up detailed report to them by September 21st. So now that September 1st report is going to have to be able to serve kind of both purposes for us, so that we have the needed information to be able to report consistent with the federal due dates. At that time, we would have counties and cities report to us on what's already been spent from that March 1st to June 30th time frame, as well as reporting any additional expenditures should you have that data. I know for the state there's a bit of lag from the time that we have a cost incurred and make a payment before it shows up in our accounting and reporting system. So there may not be a lot of additional data beyond the June 30th deadline, but we would want to know what's been expended or obligated after that July 1 time frame, and we would ask that localities are projecting their expenditures for the balance of the fiscal year. And this will really help us and help demonstrate a realistic plan for spending by the end of the year to avoid reallocation. Given the amount of money that is being provided and allocated, I fully expect the majority of the funds will be spent early on in the process, and that the those initial reports will kind of serve multiple purposes. And I think this is really important. So not only will we be asking for expenditures that will be paid with or backfilled or reimbursed with the coronavirus relief fund, but we know that the expenses and the cost at all levels of government likely far exceed the coronavirus relief funds that are available and the other federal relief that's available. And so, as I said, we continue to pursue additional assistance and relief at the federal level. So we would encourage over-reporting. So to give us a really better than just anecdotal information, but what based on kind of this reporting process are we seeing at the state and local level in terms of cost associated with responding to COVID-19 and mitigating those effects. And that serves a couple purposes. One, it helps us provide necessary data to be able to make that case at the federal level. And two, it will help us be able to understand or have a method if we have a disallowed cost later on at the federal audit points, that we have a reasonable alternative expenditure that can be swapped in. So the feds have been very clear to us in conversations with the Treasury that if a cost is viewed as disallowed or not necessary to respond to COVID-19, if there are other allowable or eligible costs, those costs could be used to then demonstrate and make the case for the expenditure. And so it's going to be really important to kind of keep those costs, keep track of those costs, devise methods to track locally, so that there's reasonable documentation and information. And then, as I noted, that report on September 1st would include a summary of your regional collaboration and kind of a demonstration that we're only billing one time for a particular cost or for reimbursement. Next slide gives you kind of a little bit of insight. This is taken directly from the report that direct recipients are required to complete by the July 17th due date. So it's fairly high level. It broadly aligns with those categories that I talked about earlier, but there are a couple areas where they are certainly asking for a little bit more information. So those kind of give you some insight into where the federal government is thinking about wanting to track and kind of the granularity of the information that they might be looking for this interim report. So as I said, this is interim guidance. There is not much in the way of definitions aside from the Treasury FAQs and guidelines that have been issued and updated over the last few months at this point. And so we will try to align our form for that September 1st based on additional information that we receive. And we are seeking some clarification at the federal level for this initial report. From a state perspective, we just enacted the budget July 1st, essentially, to be able to give us the authority to allocate most of the funds that are the coronavirus relief funds. And so our initial report is likely going to talk about the amount that's going to the local governments. And it will talk about our plans for expenditures, but because we want to safeguard and make sure that all those expenditures used or reimbursed with CRF are eligible, we will have a process kind of in place and at the state level to do that kind of going forward. Next slide. Oh, let's see. I'm trying to, we aren't doing the poll yet. We have a couple more slides, I think. So the quarterly reporting process. So this is new information that we just got from the federal government. So in addition to that preliminary report, as I mentioned, we have a more detailed report that will be due on a portal that's yet available or released, and no instructions, but there will be a quarterly report that provides additional details that's due on September 21st. And then very shortly after that, we will be capturing the first quarter of reporting. So through September 30th, that will be due on October 13th. So we may have to do some additional reporting that was not initially envisioned relative to meeting that federal reporting requirement. The current kind of high-level guidelines requires reporting on funds expended or obligated for what they determine as each project or activity. Theoretically, it could be those on the form that I showed in the previous slide, but it could go beyond that. Direct recipients are going to be required to submit a detailed list that provides the name and the description of all of those projects and activities, as well as a detailed list of any loans, contracts or grants awarded, transfers to other governments and entities, and any direct payment that's made to a recipient that's over $50,000. So what's not clear to me at this point is whether we would need to have details about contracts and grants at the local level, or if we can just report in the transfer to other governments. So that is one area where we're going to pursue getting clarification. Next slide, please. And then the next piece is about records retention. So one important point, so we originally were kind of thinking that we would keep records for about 3 years. And I think we may have even answered some questions early on relative to that type of time frame. I think we even have one particular trailer bill that used a 3-year time period. So we will have to kind of revisit that. But the retention of records is for 5 years, and it is 5 years after the final payment is made. And so what that means is that if there's some payments that don't go out until 2021, that 5-year clock will not start until that time frame. In terms of the documents that are talked about, records, they definitely say that documents have to be kept so that they're sufficient to establish the compliance with those 3 main federal categories that were outlined in the CARES Act. So one, necessary to respond to COVID or mitigate COVID, not in the most recently approved budget, and for expenses occurred between that March 1st and December 30th timeline. They do use a few examples in the guidance that was released related to general ledger accounts, subsidiary ledgers, budget records for both 2019 and 2020, payroll and timekeeping records, receipts of purchases, contracts or subcontracts that include performance outcomes, any documentation of internal audits, reports, or monitoring of recipients of the funds, and then any internal and external, both email and electronic communications. So this represents the examples that we know about today. There will likely be more guidance, so we will share that information. It's going to be really important to document the rationale and the decision-making process, particularly as it relates to those substantially dedicated staff or activity, with the exception of your public health and public safety, and then to keep those receipts and spending information. And then, as a reminder, $35 million in federal funding to support audit, oversight, and monitoring on the use and disbursement of the funds. And before I kind of hit my last or kind of closing slide and open things up for statements, can we go ahead and just quickly launch the reporting question that we had? There we go. So what we're looking for here is, do cities already have costs identified that exceed the available CRF? So recognizing the minimum to each city is $50,000. And then the allocations are available on our website if you're not sure how much you're getting or how your expenditures might be tracking relative to the amount that is going to be allocated locally. And we'll probably close this one off at the 1 minute mark because we definitely are beyond the amount of time that's available, although I did block additional time through 1:30. So we'll hang in as long as there's interest. Totally understand if people need to drop off for other commitments.
And Kristen, really quick, as you're closing out that poll, just a reminder for everyone that we are recording this webinar. So if you do have to drop off, we will have this available on our website. Additionally, along with the slide deck, we are also figuring out a way that we can make a Q&A document based off this webinar, working with the Department of Finance, and then additionally, additional FAQ guidance document based on the multitude of questions that are coming in. So we are working on different components to make sure you're getting all the information you need to expend these dollars.
Great. So I'm happy to see that 42% of those that voted are noting that they already have costs that exceed the amount that's available. I think that's generally consistent with what we were hearing and kind of expecting. And my guess is that very shortly after the initial allocations, you will have a chance to make the assessment about how far you are in kind of your planned expenditures of the CRF. A few other points on my next slide just really are some highlights that were also in the FAQs, which I will say, so there is a link to the federal, both the broad guidance and their FAQ document, which I think is now at around 12 pages of questions and answers. I use those often. I use that Control F search capability that we all have for websites, and it helps me kind of find a particular topic of interest. But a few things here. So there is a federal catalog number or CFDA number that's been identified related to the coronavirus relief funds. The funds are allowed to accrue interest, so they may be deposited into interest-bearing accounts, and the proceeds from the interest related to those funds can be spent so long as it's for that same purpose. So there's not the same prohibition as we have on some other federal funding sources in a myriad of programs. Assets may be retained. This is certainly something that is coming up. Not only do we have the funds available to cities and counties targeted to address homelessness and that overlay or the overlap relative to COVID-19, we also have a separate bucket of money that is available through our Housing and Community Development Department that can be used and is intended to be used to help us purchase some of the hotels and motels that might be helping us meet some of our homeless needs to quarantine and self-isolate and to get them off the street relative to combating COVID-19. Those assets that we purchase with the coronavirus relief funds may be retained. This is specifically addressed in the guidance. One thing that's important to note, though, is that you can't later sell those assets for a profit. And then if they were for some reason purchased and then disposed before the end of the December 30th period, kind of reuse of those funds would have to be consistent with and still apply to the guidance relative to that reporting period by December 30th. The funds that are allocated in for coronavirus relief funds are subject to single audit provisions, as well as uniform guidance as it relates to subrecipient monitoring. So that's an important thing to kind of highlight and note. Funds can be, as I talked about before, used to cover expenses related to audits conducted under the Single Audit Act. I will say this, because of that timeline and the likelihood that most audits will be well beyond the December 30th timeframe, Obviously, audits that go beyond that date would not be eligible, but should internal audits be conducted or a state audit be conducted to the extent that there's expenses related to compiling documents, et cetera, to either provide to our Office of State Audits and Evaluation or to the state auditor or the state controller under their broader single audit requirements can be reimbursed. And then just wanted to flag here that competitive bidding is not required related to the use of the funds. There's still a requirement, as I said, that the use is necessary, but there's not a requirement for competition that kind of directly is somewhat in conflict with the ability to be able to get the money out quickly. And my last slide, I think, is coming up. So this information, as we shared, will put you in contact with staff at the Department of Finance. So our local government unit is tracking and managing the CRF applications mailbox. That mailbox can be used as well for questions that might come up. And then the federal reporting / research unit, which is our COVID federal tracking that my unit has set up predominantly to work with other departments related to federal tracking and reporting of the coronavirus relief funds, can be used to get in touch with myself and my colleagues. So it's a mailbox that I monitor along with my staff that we could use to provide responses to questions. We do intend, and we have been gathering and tracking a lot of the frequently asked questions. We will probably consolidate them, so we won't, respond to hundreds of questions in an FAQ, but we will try to group like things together and provide additional guidance and FAQs, and we would post that on our page related to COVID-19, which we've set up for a variety of purposes. And then I'm also providing links to the US Treasury main page for state and local governments related to the CARES Act, as both the guidance and other documents are available there, and are a good ready reference if you need them and want to kind of explore options and areas in which you can put these funds to local use.
Kristen, thank you so much for that. And then also as a reminder, when you are emailing these email addresses, it is very helpful if you also email the League's COVID email address, which is covid-19@chcities.org. This allows us to also track those questions and to help be responsive as well, to see what questions that are coming in, if they are more broad-based questions or very specific to your city. So Kristen, you ready for a few more questions before 1:30? Thank you.
180 of them, which I see is the count.
We are not making it through 180. I'm sorry, all. So we are tracking these questions. We are going to work with Kristen and her team to figure out how best to respond to these. So please know if your question was not answered today, we are going to be working on how we can get you information timely on this. A couple of broad questions. First off, is the reporting by July 17th. Is there any requirements for cities to get you information by July 17th, or is it just your reporting requirement to the feds?
No, it's just our requirement to the feds. There simply isn't enough time. They notified us on July 2nd, by the way, of the need to report by the 17th. So we will take the first crack at it. We will probably just put on the amounts that are transferred or planned to transfer to local governments. And we're going to have to caveat what we have, because we know that even though expenses have been incurred, they have not yet been bumped against that eligibility criteria for CRF. And so, we will be doing that over the coming weeks and months. And we've put some tools and procedures in place, both at the state level to kind of track and account for, and then we'll use the September 1st reporting to help support the next round of more detailed reporting.
Great. And then when we talk about reporting, is just to break it down very simply, how, when, and where should they be reporting to? Or is that information you'll be working to get out to us that we can distribute out to the cities and also put on your website?
Yeah, so we will do some sort of communication. It will be on our website. We will likely use the league, but we may use other means or methods to do that. As we get closer and get more clarity and information from the federal government for that September 1st deadline, I am still hopeful that it will be a very short and straightforward form. Yeah, one page, maybe two, depends on what the feds surprise us with in the coming weeks. But will really be, and then a few columns. So, expenses that have already been incurred up to that June 30th timeline, kind of the idea of what's been expended or obligated since July 1, to the extent the data is available, and then what are the forecasted expenditures, largely in those broad categories. So really view this as a checkpoint, and there will be lots of communication to anybody that we think is not likely to fully spend their funds by the end of the year.
We appreciate that. Thank you. Then as we talk about the spending of funds, can you go a little bit more over the spending deadlines for these dollars, what cities need to be doing, what the requirements are from DOF versus what the feds are requiring?
We're still sticking with that December 30th spending deadline. So generally, we're going to really strongly encourage that means spent, cash out the door, not just obligated, but we understand that there's some obligations that might be later in the calendar year. But we really do expect that the majority of funds are spent or on track to be spent, and that check-in report will be the place in which we can kind of assess that.
Great, thank you. We've gotten some questions on this, and we've been clarifying to our cities as they've come in. Can you just explain the difference that this is an allocation versus a reimbursement program? Well, so first at the federal level, they have kind of viewed this as financial assistance. I think I have something related to that somewhere in my slides. So it's a little different than a grant, a federal grant. So it has slightly different reporting and accountability measures, obviously subject to all kinds of back-end type reporting, but we don't need to see receipts and detailed contracts to be able to pay. We're assuming, given the kind of unprecedented nature of COVID and the response that's been required, that there are numerous expenditures that kind of fit broadly into the criteria. And so, we will be making the allocations based broadly on that. Obviously, if there's entities that aren't on track to spending and other entities are far exceeding, we still intend fully to keep the money that was allocated at the local level at the local level. So we wouldn't anticipate shifting any of those costs to other allowable uses or back up to the state. We would keep it locally, but we may, depending on how the spending is going, we have the ability through the control section to reallocate those funds. But we would not do that until after we've exhausted kind of remedies and conversations with local entities on, have you considered this type of expenditure versus that type of expenditure, just to make sure that they're casting that wide net and can fully use the dollars that are intended for that particular city. And we appreciate that. And I think this is also a great opportunity for a plug. If there is we are hopeful this will not happen, but if there are unexpended CARES Act dollars, that the opportunity to do another allocation out to local government cities specifically would be amazing. So we would really appreciate that opportunity, and we'll continue to work with you over the upcoming months on that. As you talk about as the federal requirements and such, how are these funds actually deemed for cities? Are these actually considered state funds or federal funds, just for their reporting requirements and how they have to track these?
They are still considered federal financial assistance subject to single audit.
Okay.
Even if they're passing through us. We are on the hook if there's disallowed expenditures, but we are sharing that risk through the budget control section.
We appreciate the sharing of risk and the dollars that have been allocated for the cities. Question I know that a few cities have struggled with in the past couple of months when it comes to the difference of where counties and cities may be in compliance with the governor's executive orders and the Department of Public Health orders Is there anything that cities should be doing if they have a county that could potentially be out of compliance, what the city can be doing to show that they are trying to be in compliance with those orders, just because of how that nature of the local health director being at the county level may be making orders that may be counter to what the state is stating that needs to happen. So is there any guidance on that right now, or do we need to be working with you on those one-off circumstances with Cal OES and DOF?
Yeah, so certainly if there are those kinds of circumstances, the state is wanting to collaborate locally to kind of move towards broad compliance, right? Both at the state, at the city level, at the county level. Just to kind of reassure cities a bit, those two public health requirements that I talked about and the slides that deal with the requirements that counties must meet, we know that cities are a partner for that. We know many cities are helping support testing so that there can be more testing in their communities, et cetera. So they are certainly helping to contribute to the volume of testing that's required at the county level. But those are really county responsibilities. So it's really just that third item that we would be looking at from a city perspective. So no ordinances, no resolutions at a city supervisor board level that are kind of counter to the broader public health mandates.
That's helpful clarification. We appreciate that. And certainly we'll work with you if there is any concerns that are coming up of concerns of non-compliance. Going back a little bit to that FEMA cost recovery component, or FEMA, are cities able to still continue to pursue FEMA cost recovery even if they're receiving the CARES Act allocations?
Yes, they are certainly able to pursue any and all cost recovery through FEMA, but we know that process can take years, not just months. But yes, you should continue to work with Cal OES. Cities should continue to work with Cal OES to pursue reimbursement as you would for any disaster that's eligible. Continue to track those costs and make local decisions about pursuing that reimbursement. The piece that's kind of a little more tricky is whether you can use the coronavirus relief funds as that public assistance match.
Okay. And we'll certainly be working with you on those as they come up. We've gotten a lot of questions about public safety, and I know you had talked about the fact of that those are fully recoverable, but can you just clarify for everyone, just to the extent, and we've had very specific questions about, we already discussed emergency, EOCs, but ambulance drivers, firefighters, how are those all encompassed and covered? What's that definition that falls for them?
So we have broadly been using the public safety definition that's both in federal law and state law that covers a wide range of personnel. I will try to get that and send that or share that with you. I know that there have been some questions about if you contract. We know many localities do contract for services. Those contract costs are still, meeting your public safety or public health need locally. And so those would be fully allowed from a reimbursement perspective for CRF.
Great. And then kind of a couple of, as we were talking about restaurants a little bit earlier during the webinar, we've had, specifically we look at Sacramento, since you and I both are located here, downtown, that they have moved a lot of their operations outside. Well, now they have to be outside, but they're using the public right of way for that. And are those costs that are associated with setting up the public right of way usage for restaurants, could these be eligible recoverable cost?
I think as long as they meet that test of necessary to respond to and mitigate the spread of COVID, and that there's kind of a real rationale and expense related to some of those shifts, because certainly we're using spaces differently. So if you're, say, blocking off using fencing, which I've seen in some areas, some of that public right-of-way space, the cost for the rent, the fencing, certainly could be eligible and allowable under CRF. So I would say yes, but dot your I's, cross your T's, and just explain why that's related to, again, that public public mandate and mitigating the effects of COVID-19.
And you brought up a really good component there about fencing and such, and thinking through with not only having the pandemic, we've had a lot of civil unrest lately that's kind of paralleled this. Are some of those costs that are associated with civil unrest response, could these fall under eligible uses for these dollars, or if there is a tangible way to make that connection, such as additional security, building protections and such, just because they don't have the security around that they typically would have if we were in a non-pandemic environment?
Yeah, that one's a little bit trickier, and we know that there was separate federal, support and other things that were done relative to the civil unrest. I think it's going to be a little tougher needle to thread. If it's about, different kind of screening protocols for somebody, such as taking temperatures or querying kind of on some of those questions, those are a little more clear. I think you get into more of a gray area. And what I would say is that you probably have better options for being able to maximize the use of the funds than some of those that kind of have this, that are a little bit in the gray area for us.
And I appreciate that clarification. That's come up a couple of times in discussions with some of our cities of potential eligible uses. Thinking through of, we've had, many of our cities are obviously going through budget issues right now, just as the state has. And some of them have had to, because of what's happened with COVID, they've had to go back in and restructure their budgets, or they've had to go and expend dollars for economic recovery that were not planned. So they've had to use staff costs and resources to address these components. Could those be potentially considered eligible uses as, we're looking at having to redo budgets, or, different unanticipated economic recovery aspects for whatever that city needs, helping businesses? Could those be looked at as a potential call?
I think generally those could be eligible. I would certainly make sure that kind of safeguard and walk the line of trying to backfill those lost revenues that kind of required that retooling or adapting a budget. But certainly if you're trying to mitigate some of those effects by providing economic relief to businesses in the community, that certainly, obviously, if you're providing some economic relief to them, that may help them be able to have their doors open, which can then further, the collection of sales tax revenues associated with that particular entity. But, it has some mutual benefits as long as it's very targeted to, payroll support, reconfiguring spaces, personal protective equipment, or kind of the plexiglass barriers that we're seeing everywhere, signage. All of those costs are very clearly eligible costs.
And then just thinking additionally along of how city staff are spending their time, a lot of staff have been diverted to manage, monitor, and mitigate the virus. So there's still regular compensation employees, they're not on overtime. Are these going to be potentially considered eligible expenses that could be shifted, or is it going to be that walking a fine line of how we have that, substantially dedicated if they're not considered public safety?
Yeah. So what I would say is that if you have the means to track in some manner that people were shifted, so we are no longer able to run a parks and recreation program, for instance, and you're now using some of those staff or resources instead of being parks and rec employees doing that they're helping with, handing out individual meals to high risk populations, or helping, do extra cleaning in a homeless shelter, all of those kinds of things. You can really, I think, pretty clearly crosswalk that. So I think it's about crosswalking it and showing where those staff have been diverted. So we're doing that at the state level. In my county presentation, I mentioned a statewide budget letter that we issued to kind of give instructions to our departments in our state accounting system, Fiscal, to report and categorize expenditures. So to the extent that local governments have the ability to do something along those lines, whether it be an accounting system or a timekeeping system that lets you be able to make that case, I think you can do that. But there is going to be kind of that documentation and that crosswalk that would be needed to be retained for that 5-year period.
And that is helpful to know. We do have one city that has an interesting where they didn't necessarily have any additional appropriations because of COVID, but did declare an emergency. So they're curious if they are going to be eligible for reimbursement for these funds because they're not outside their budget parameters, but they're going to have potentially eligible expenses that fall within that, you know, how we can look at balancing some of that.
Yep, so certainly public health, public safety, those are easy. If you do, you know, if you can demonstrate that line item budget related to that, those can be fully shifted. And then as we said, if you can document and crosswalk substantially dedicated and necessary to spend, even if it's within the broader umbrella of, let's say, $1 million local budget, you spent that $1 million, but you spent it on completely different purposes. Those are certainly eligible uses.
And as I, again, looking through the multitude of questions we've gotten, just really clarifying the fact that the cities are able to purchase PPE and other protective types of equipment for businesses and different industry sectors within their cities to help address the spread of COVID, that those will be eligible expenses.
Yeah, they're all necessary to respond to and mitigate. So yes, I would caution that it's not, that all the money isn't spent on something like that. I think that, a mix of uses is probably going to help the state and, cities and counties. And we know that the needs are vast in many areas. And then the only thing I would say is that you don't want so much of that type of PPE distributed that it's really being stockpiled and not actually being put to use. We don't want any hoarding of PPE. And I will also say the state is doing a lot in a number of areas to kind of also provide that type of relief, right? So we have some very large contracts at the state level, and there are, certainly we're helping with hospital supply chain issues. We are helping with schools and others. So that responsibility and that burden is not just solely on a local government.
And we appreciate that we're in this together.
Yes, absolutely.
And I think I really want to highlight that phrase as we're going to close this out, because I know you have a 1:30 stop time. And I want to give you one last opportunity if there's anything else to highlight. But one thing that you just said was that it was necessary. What's the exact phrase?
So that is actually in the Federal CARES Act statute. So it's one of the few things, but it's necessary to respond to and mitigate the effects of COVID-19.
Okay, perfect. I feel like that will be our new philosophy as we're looking at these dollars. That's why I want to emphasize that. I want to give you an opportunity for final thoughts and then give our president one last opportunity if he has anything additionally he would like to offer, and then just do a quick wind down of what we have coming up next.
Yeah, really, what I want to just close with is this is a partnership. We very much view this as working collaboratively, and the Department of Finance is kind of poised and ready to support local governments, continue our work with the League to be able to help get information out and to support kind of both our response and our recovery. And certainly both are mutually beneficial.
Very much so. President Dunbar, would you like to say any last remarks?
Sure, thank you. And Kristen, thank you so much for all this information. We have had the largest participation ever in our online webinars today. You can tell the urgency and the importance to our cities, the kind of information you've been sharing. Just two words that I have been thinking about throughout your presentation that's critical to our cities: transparency and accountability. And so we can't emphasize that too much, that our cities, just in case we do in fact have to see additional rounds of financial support going forward, if this continues to play out over a longer period of time, we need to have a track record of spending these dollars appropriately and accurately in order to be in a good position going forward. So I think those are a couple takeaways that all of our members will need to follow as we go forward. But again, thank you so much for all your information today.
It has been my pleasure, and this is certainly the biggest event that I have done in probably in my career even, and it's been a long one. So we look forward to continuing to work with you and your team. I've really been pleased with the staff at the League and how they organized and coordinated this. They represented the cities very well.
Kristen, those are very kind words, and we appreciate the partnership we have working with you in how we are able to get all these dollars expended for cities, and as we will continue talking about, hopefully getting more dollars for cities, not just for this, but also our revenue loss issue that I know the state is actively working with Congress on as well, just as we are, and looking forward to those opportunities in the upcoming months that we're able to secure more dollars for local governments. So again, thank you so much for taking time and for being a part of our largest webinar we've ever done that I'm sure will be watched probably doubly, and then we'll have a lot more contact with you in the upcoming weeks. And as we indicate, we'll be in contact about how we can best compile an fact sheet and get information for the almost 200 questions we have now received to make sure we're able to address those. Yes. So figure out how we can address each city's questions, but looking at the broader, what are the more general side of how we can approach things. So we'll certainly be working on that with all our cities. And again, we'll make sure that we get the contact information out for you for the emails, and then also we'll send out the information for the League's COVID email address, which is covid-19@cacities.org, for you to submit your questions to, so we can continue to follow up with Kristen and her staff at the Department of Finance. So with that, I want to just wrap this up very quickly of the next upcoming events that we do have. We are doing a webinar series regarding wildfires, resources for cities. So this is an ongoing webinar over the next few weeks. So tomorrow's webinar is about communications during a wildfire. You can register for this webinar at www.cacities.org/events. And then for the webinar that you just watched today, you can see this. You could find the slide deck and the webinar recording hopefully later today, if we'll have to get some time to get this put on the internet. But that website for that information is www.cacities.org/coronavirus. That is also our one-stop shop for a lot of information that will be resources for each city for different components about how you can address COVID-19 issues in your communities. So again, thank you so much all for taking time and taking a lot of time today to walk through this. We know you have a lot of needs. We know you have a lot of questions. We will continue to work with you in the upcoming days to make sure that we can get them all answered. So thank you for your leadership in your communities, and we look forward to working with you in the upcoming months on this. Have a good day.